Welcome back, friends, to TV5 News at 9. Joining us this morning is Dr. Hesham Gayar. Thank you so much for being here, Doctor. How are you?
I am fine, and thank you for inviting me with you today. This is wonderful.
We are so excited that you're here. Great information Dr. Gayar has. Today we are talking about proton therapy for sarcoma. First, doctor, can you explain what is proton therapy?
Proton therapy is a special form of radiation. It's a subatomic particle. Instead of going through the body, I'm going to share a brief video that will help illustrate what I'm talking about. So it is basically a subatomic particles. If this is a tumor inside the body and we are sending a beam of radiation to treat it, which is a common treatment for cancer, this is the conventional radiation. And now this is proton therapy. Proton therapy is particles that are laid in spots to cover the target precisely, avoids all the red outside the target, which is radiation. So you're giving radiation that belongs right where you need to deliver it, at the tumor, not at the normal tissue, not at our organs that are sensitive. So proton therapy is a specific, precise form of particle radiation. It's also more effective than the conventional radiation, 10% more potent to the cancer, but the main value is in protecting normal tissue. So if I'm treating the cancer next to the brain, next to a spinal cord, next to the rectum, next to a bowel, next to the stomach, next to the kidneys, I can spare the spinal cord or the brain or the kidneys or the bowels and deliver the radiation only at the cancer. Very great precision.
Yeah, you can see that.
So it is a special form of radiation that is delivered by high accelerators that like almost a nuclear reactor, making radiation beam that are very precise and expensive.
Yeah, we could really see that with the visual you had, how precise.
Does that explain what proton therapy is?
Yes, that was excellent. We love the visual too. We could actually see the precision there. Doctor, what are sarcomas and why might proton therapy be a good treatment option for sarcomas?
Yes, proton therapy can be used for any form of radiation if it's close to a sensitive structure and it's important to save that structure. One of the difficult tumors to treat in cancer management, as a cancer doctor I see, are sarcomas. Sarcomas are rare tumors. They are tumors of the soft tissue. So they don't grow like in the breast and colon and lung like the normal that most of the cancers do. They grow in the muscles or in the back of the abdomen or in the face or in the skull or in the bone. They're a connective tissue tumor. You don't screen for them, so it's very difficult to find out if you have a sarcoma or not. But if you have a lump or a mass somewhere, take it seriously and see your doctor. This could save your life if it is sarcoma. They're serious tumors. They spread, and when they do, they spread to the lung. If they're treated early, they're caught, and surgery and radiation is very effective in curing them. And sometimes you can't remove them, or removing them will mean you lose an organ, where radiation can kill the cancer and spare the organ. And often you use radiation after surgery, where proton therapy can help deliver higher doses safely. So sarcomas are some of the indications of proton therapy because regular radiation, the conventional radiation, cannot give enough dose because it covers the organs around. Because proton therapy is so precise, it affects the cancer and it protects the normal tissue around. We can safely use it to treat sarcomas. That can be done alone without surgery, sometimes after surgery or before surgery. Sarcomas can occur in different parts of the body, like the abdomen, the legs, the head, the neck, the skull, the bone. They can occur in any parts of the body. Sarcomas also can occur in younger people. So younger people don't usually have cancer, but among cancers in younger people and children, sarcomas are common, unfortunately. And proton therapy is the best treatment for them. So it is #1 treatment with radiation for patients with sarcoma. So if you have heard that word, or if you know someone that have that word, and you're looking at radiation as part of your treatment, consider proton therapy before you take the conventional radiation. Actually, for any cancer, for breast cancer, for example, in the left side, in the left breast in particular, the heart is close by, and often common radiation, the normal radiation, can spill out to the heart. And the way you send the beam, because it goes through, some radiation will go to the heart, especially in left side breast. But proton therapy can stop before the ribs, so zero radiation to the breast, to the heart. And less radiation to the heart reduces the risk of heart complications later on. And so on, brain, any tumors in the head and neck area, giving the proton therapy will spare organs. And the head and neck and the brain are very high real estate, high value real estate, I should say. So protecting any organ from even low doses of radiation is worth it. And the main advantage of proton therapy is the precision. That it treats only the target, and it avoids unnecessary radiation in the surrounding tissue by more than 70%.
Wow, that is impressive.
We also use it sometimes when we have cancer coming back again after previous radiation, and they tell the patients, oh, you cannot have radiation again, but proton therapy we can safely give again, even if previous radiation is given, without side effects.
Now, doctor, are these rare types of cancer sarcomas, and is anyone more susceptible to them?
These are rare cancers, and everybody is susceptible to them. It is not familial, so it is not well known to run in families, except some special sarcomas. So the disease is rare, but it can affect any age: children, adults, young adults, and older people as well. And it can occur in any part of the body. It's a mass or a lump or a tumor. Sometimes it's seen incidentally on CAT scans. Sometimes people feel it. You may have a mass in your thigh or in your leg and ignore it until you see it getting bigger. Don't wait on that. Go to your doctor, see what this is. They will do a biopsy. Needle biopsy can tell if this is sarcoma or not. Or sometimes imaging. MRI in particular is the best for imaging of sarcomas.
And Dr., how
proton
can
therapy as a particle therapy that is precise, works better, and gives great results in control because it spares normal tissue. Also, the side effects of radiation are avoided, and regardless for any cancer. If you use proton therapy, you get less side effects. So we can treat head and neck cancer or prostate cancer or pancreas cancer with less side effects. No nausea, vomiting, side effects of the treatment, usually no hair loss. And of course, depends on what organ you're treating, where you expect certain side effects with conventional radiation. But that is completely avoided when you use proton therapy.
And doctor, how can a patient know if proton therapy is right for them?
Well, basically, that's what the best way is. If you have cancer, before you seek treatment, before you get the conventional treatment, call us. Let us know or ask, inquire, is proton therapy appropriate for me? Find out if this special treatment can help with your disease. And this is approved and covered by insurances, by the way. Almost all insurances cover proton therapy, and Medicare does, and it's now off any restrictions. So this is a good treatment, precise, that is covered by insurance, and the best way to find out is call us or reach on the website. You can call 855-MY-PROTON or go to the website mclaren.org/proton treatment and learn or ask a question, and we'll be glad to answer. And you don't have to travel. We can just communicate with you, find out the facts, and see if this is possible or not, or even have a telehealth visit with a doctor wherever you are by Zoom and find out the facts. If it's worth it, it could save your life, or side effects that are not necessary.
Don't wait, get that information. Thank you, Dr. Gayar, for bringing us this valuable information today. We appreciate you.
My pleasure. Thank you for having me, and it's a great program.
Of course, you are so welcome. You can find out more information in the hot link section at WNEM.com.